most famous physical therapist on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today we're going to show you how to fix Achilles tendon pain in 60 to 120 seconds. We're going to include tendonitis, strains, and tears in case you have trouble knowing what's really going on. We'll give you some hints.
Right, we're going to give the whole spectrum.
There we go. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, you hit us on the right week here, folks. Go to bobandbrad.com. We're always giving something away. We're giving away a mattress, a Sleepovation mattress. Awesome. We're also giving away a couple of Sleepovation pillows. We'll talk about it just in a second. Like I say, go to the giveaway section. Also, you can find the contest. It'll be pinned to the top of the page on our Facebook. Go to Instagram, Twitter, or TikTok if you want a 60-second version of our program. So this is just a sample of the mattress. It's actually much larger. You get all the sizes you want. But it has 700 individual mattresses, really spread out the comfort for pain. And it's also got individual air channels here that it can make it a little bit cooler. All right. You done playing, Brad?
Yeah, get that out of there before you
go to work,
fall
Brad.
asleep on it. Okay, Achilles tendon pain. This is a very common injury. And the reason it is, in my opinion, of course, is, and I think this is well accepted throughout the therapy community and medical community, every time you take a step, if you look at my foot and the heel comes off the ground and my left foot leaves the ground, the weight of my whole body is going through that Achilles tendon as a lever, so to speak.
Yeah, you see a lot of weekend athletes can injure it. A lot of tennis players, where you're really up on your toes a lot, and putting a lot of stress on it.
Or if you're climbing up a hill,
sure,
hill climbing, going up just any kind of incline really increases the force. There is one thing before we go any farther. If you have a full thickness Achilles tear or rupture, this video is not for you.
Well, you're going to know that because you're not going to even be able to walk.
You're going to have surgery.
Yeah, you're going to have surgery.
Right.
I think that's the one Bill Clinton had, didn't he? I think he...
Bob, we don't cover politics.
Well, it's not political. He just had a tear. So...
Well, anyways, if he did, he's probably better by now.
Right, he is.
So it's a large tendon, and let's take a look at it.
Sure.
So... And where's my...
A very thick tendon.
Very thick. Yeah. It's because of the forces that it goes on. You know, it connects to the calcaneus. That's a very large bone there. Very solid connection, which is about right here. And right here, it's very thick. I'm just going to draw it in.
It splays out here, too, I think.
Yep. We'll get it all on there. We do have high technique and high everything.
High technology.
Yep. So here we go. It's not back in here, though. There's a hollow spot there. That's going to be important for the first technique on how to treat this. And then somewhere in here, it goes from a tendon into muscle.
It transitions into muscle.
And it's not an on-off transition. It kind of, tapers and whatnot goes out. And that's important to know, too, as we talk about some treatment. So there we go. Now, the first treatment, if you are having specific pain in your Achilles tendon, and you can feel it in this tendon, because you'll feel it's very palpable. What you're going to do is we're going to do a cross-friction technique.
Right, cross-fiber friction massage.
And you're going to take your fingers like this, and if you get that pincher technique, now I usually support my pointer finger with my third digit, my middle finger, and this one, so I can really have a good, strong pincher grip. And I'm going to go right around. I'm going to do it this way so I can do this better. I'm going to go around to the back side of that tendon a little bit. And I'm not going to go vertically, the massage. It's going to actually go horizontal.
So you're really on the sides of the tendon. Right?
Exactly, Bob.
The injury, the tear, usually does not occur on the back of the tendon.
Right.
It actually occurs more often, they find, on the sides.
Yep.
Sometimes on the inner side, which you can't get to very easily.
We would call that the anterior aspect, but it's up in there.
So you're going to want to work both sides of the tendon, rubbing back and forth. And Brad's being very aggressive here. That's not just a light, pushing on the skin.
I'm not doing this. I'm not moving skin. I'm getting into the tissues of that tendon. And my leg is moving because I'm getting after it. I need to actually hold it still. And you want to relax the leg. You're not pulling, you're not stretching at the same time. You're not pointing down or plantar
Yeah,
flexing.
you want it in a relaxed position. It's
Yep.
funny. The last person I saw with this, Brad, he's a really good golfer, and he had it for quite a long time.
Mhm.
And this is all I did. I took a few minutes and showed him this. It went away.
The first time, or did you have to do a
it-
few
it-
techniques?
he had to do it for a few times.
Yep.
But I'm saying he had it for months.
Yep. And it was
And-
clear that this was the game changer.
Yeah, and this what happens is, there's micro tears in there, and it starts to heal. You maybe overnight it
Yep.
starts to heal. Then you get up and you re-tear it.
Yeah.
This stops it from re-tearing it because
Breaks up that
it breaks
scar
up the
tissue.
scar tissue
Yep.
and it gets more blood flow to that, so it heals lengthened
Yep.
and heals stronger. So this is the money treatment.
The game changer, the money
game
maker.
changer,
Yeah.
yeah.
So yeah, what it was. Now I lost my train of thought,
Oh, yeah,
Bob.
I'm sorry
Why,
about that.
Bob? Why? So Bob, I know the viewers are going to give this question. I haven't answered it. Is how
Sure.
long do you do it? 5 minutes, 10 minutes, and that's in the title of the video.
Right.
60 seconds to 120 seconds.
Sure.
And you could do it longer than that, particularly as you do it. It feels better, kind of a numbish feeling. That's gold. You know it's going to improve. But what happens is your fingers get tired.
They do.
And you got to give
And
it a
that's
break.
why you may want to do it multiple times during the day.
Yep.
The other thing, you kind of alluded to this, Brad, is that if you're doing it and it just starts getting worse and worse when you're doing it, it's probably too early.
Yep.
You're maybe going to want to ice it for a couple
That's
days.
right. Get a cold pack on it, 15, 20 minutes. Give it a break and don't walk on it so much if you can do that.
Right. You may have to use a cane or a crutch for a few days.
There you go.
Or sometimes we have people put like a little heel cup or like cut out a piece of carpet
Yeah.
and just put it in their shoe to raise their heel up a little bit, and that takes stress off the tendon
Right.
for a couple days.
Yeah. That's getting a little more technical.
No, it is, but it's useful information.
Sure.
But again, if it's getting worse, you got to stop. If it's getting better or it's getting numb, it's the right treatment.
Yep. Now the next thing, what if you do this and it's like, oh, my tendon feels okay.
Yeah,
it's
there's
not
no tendon-
tender.
There's no tenderness there.
But the pain, then you realize, oh, the pain's up here. And sometimes if you have a torn muscle here or a strained muscle here, it may refer pain into the tendon.
Yeah.
It may refer pain up here. So then what you're going to do is actually palpate or dig around in your muscle and find a specific spot. And a common place is right where the base of the gastroc
In the
connects.
soleus.
Yeah, right in there is a common place where you'll get that
Well, it's
painful
often
spot.
mid muscle belly.
Yep.
Is what it is.
Yep.
It's in the midpoint of the muscle belly.
So when you find it, and you'll find it, it'll be like, whoa, that's a hot spot. And it may be all knotted up, kind of like a Tootsie Roll in there. That's the spot you're going to do your cross friction massage, similar to the Achilles tendon, but the fibers of the muscle go this way. We're going to
So,
go.
Yeah, you don't have to do on the sides on this one. You can go right across the
Right.
back of it.
So let's say it is right there. I'm going to take my thumbs and I can use both, or you can use the fingers, whatever works good, but get into that.
And again, he's going across it.
Yeah. And it's going to hurt at first. That's very normal. But by 20 to 30 seconds, that pain should resolve into like, oh, that feels better, or it feels numbish. Then you're going to go until your thumbs get tired and sore. It may usually a couple minutes and you're already there.
Sure.
And then you're going to do that throughout the day, maybe 5 to 8 times, as long as it responds. If you do it, it just hurts more and more. You need to give it a break.
Yeah.
You can maybe do a gentle
Same
massage,
thing.
cold pack, give it a break for a
And
day or
again,
two.
less weight bearing on
Yeah.
it. So-
Now, there is an option if you don't like that kind of pain to start out with for the first 20, 30 seconds, and that's called positional release or strain, counter strain. And to be honest with you, I would do this one first because it really doesn't hurt. And we've had really good success with
Yeah,
it.
it's been amazing to me. It's certainly a good adjunct to do along with it. In some cases,
The adjunct, that's a good one.
Yeah, in some cases, it may actually take it away.
Right.
So-
So shall I show them that?
Yeah, let's show them
And
that.
it's in a comfortable position. You don't have
Yeah,
to stand
that's
up.
what's nice about it. It's not. Didn't you want a pillow?
Oh, sure, Bob. Now I know he does care. So this is what I'm going to do is you can do it laying on the floor or a bed. I would do it in bed because it's a little more comfortable, but it's not important. Is you lay on your back. Now with positional release or strain, counter strain, the whole goal is you already found that sore spot and you rub on it and give it a number. Say it hurts. 10 would be you're screaming and yelling. 0 is no pain. And I get there, oh, that hurts. I'd give it about an 8 when I'm pushing on it. So we know the level of pain it's at with that pressure. Keep that in mind and forget about that for now, but don't forget about it, but just temporarily. We're going to shorten that muscle as much as possible. Now, because we're therapists and this is our job, we know to shorten. So we need to flex the knee as much as possible, and you can bring the knee up and flex the hip. That's okay. And then the ankle, we need to plantar flex. So to do that, I'm going to hold here, and I'm going to just
toe
put some
actually goes down.
put some gentle pressure there. And you may want to take the ankle and rotate it in or out, and you're going to find the position of maximal comfort. I mean, if it feels more comfortable when I bring my knee out here and I pull in this way, that's fine. You're just going to kind of play around with it. And when that pain level goes down close to 0 or 1, then you're going to hold it. And it's very critical. You don't start the clock, and you need to use a clock on this. Go 90 seconds, no less than 90 seconds to get that muscle. So once again, once you find that position of maximal comfort, you're going to relax, you're going to breathe, and you're going to hit, literally, you have to be looking at a timer or have someone time this for 90 seconds, no less. The studies have clearly shown you have to hold that position of comfort for 90 seconds, and you can go longer, up to 120 seconds. One way or another, that's the time, and then you're going to slowly come off from that and relax. You can gently move your ankle up and down, nothing aggressive, and you're going to get up, stand, walk around gently, and give yourself, 5 or 10 minutes where you're going to do no aggressive activity. And obviously, it's still going to be injured. It's not going to heal it like that, but it's going to give you a big step in the right direction because it increases the blood flow in that muscle, which is what you need, and to get the muscle relaxed to achieve that enhanced healing
Yeah,
time.
I think what happens quite often, Brad, is that it breaks up the pain cycle.
Sure.
When you get a painful area, like a lot of times you get knots, the pain makes you tighten up even more. The
Yep.
muscle in response
Right.
gets more pain, tighten up even more.
Yeah.
It just goes on and on and on.
Yeah.
This breaks up that cycle, and sometimes that alone, again, you kind of did it for my hip, and like you said, I was like, oh, I don't know if it really helped. And he goes, well, you haven't had pain since? No.
You forgot about it.
I forgot about it. You kind of forgot that.
I had
even
the same experience with my tennis elbow.
Yeah.
But again, nothing new. This has been around for
Yeah, this has been a long time.
a long time, 20, 30 years.
Yeah.
So one way or another, between these 3 options, you're going to find one of them that's going to give you some relief and get you going on your feet better.
Make your comments below. We always like to hear from you. And remember, Brad and I can fix just about anything
Except for
broken heart.
But we're working on that.
I wonder if we can do cross fiber on that.
No, Bob. That's too invasive for us.
Okay.
No,
All
we're
right.
not going there.
Ciao.